Network Postcard Party. My name is Dave Ford, and I'm your host for today. I've been a member of ACS CAN National Board of Directors since 2021, and I'm a member of ACS CAN's Black Volunteer Caucus and have been an ACS CAN member since 2018. I am also a colon cancer and a prostate cancer survivor. But let me start by first introducing the incomparable James Williams Jr., Director of Federal Relations for ACS CAN and a longtime volunteer of ACS. James is a two-time prostate cancer survivor. It really gives me a privilege to introduce you to James Williams Jr.
Well, David, thank you for that kind greeting. Look, anytime a young fellow like you can introduce me, I feel privileged and honored. And it is also, I'm so excited that we have the privilege also of introducing Ms. Nadia Lanian, Legislative Director and Counsel to Senator Cory Booker, who's one of New Jersey's two senators. And one thing I've said for many, many years is you can't be an excellent senator or an excellent member of the House if you don't have an excellent staff. And Ms. Lanian is widely and highly regarded for her expertise, skill, and intelligence in Congress. I mean, this is the first time, I hope everybody understands this. This is the first time in history PSA for him legislation has been introduced in the Senate. And that's in no small part thanks to the leadership of Senator Booker and the leadership and expertise of Ms. Lanian, who will bring remarks on behalf of Senator Booker. As you know, the Senate is very, very busy. The House is still in session in special orders. And even though we don't have a year-end bill we have to deal with right now, there are many, many things that are happening. And it's a lot for her to take the time to meet with us this evening and for Senator Booker to allow her to spend time with us this evening. And, thank you so much for your time, Ms. Lanian. And the floor is yours.
Well, hello. Can you all hear me?
We hear you just fine.
Great. Thank you so much for your kind introduction, James. It's always great to work with individuals who have formerly worked on Capitol Hill. There's a camaraderie there that only staffers know. So as James said, my name is Nadia Lanian, and I lead the health portfolio for Senator Cory Booker. Unfortunately, Senator Cory Booker could not be here this evening, but I am grateful to have the opportunity to speak on his behalf. So there is a great African proverb, which my boss likes to quote. This quote is many times. And it goes, if you want to go fast, go alone. If you want to go far, go together. One thing I've learned working in Congress is it takes a coalition to make anything happen. Senator Booker is honored to have worked alongside the Black Volunteer Caucus of ACS CAN, Sigma Gamma Rho Sorority Incorporated, an organization of which I am a member of, Omega Psi Phi Fraternity Incorporated, Delta Sigma Theta Sorority Incorporated, and Sisters Network Incorporated, in this coalition's effort to introduce the PSA for Him Act in the Senate. Senator Booker is also very proud to have introduced the PSA for Him Act as a bipartisan bill, co-leading the bill with his colleague, Senator John Boozman, a Republican from Arkansas. Like many issues in our healthcare system, there are disparities in who is at higher risk of developing prostate cancer than others. For prostate cancer, those groups include Black men and men who have a first-degree relative who has been diagnosed with prostate cancer. Black men in the US have among the highest documented prostate cancer rate in the world, and their cancer deaths are one of the greatest mortality disparities in oncology. Black men are more than twice as likely to die from prostate cancer than their white counterparts. Another group that is higher risk are men who have a first-degree relative, father or brother, with prostate cancer. This more than doubles the risk of developing the disease, and the risk is even higher for those with several affected relatives. The prostate-specific antigen for high-risk insured men act, PSA for Him for short, will remove the hurdle of copays for PSA screening tests when caught for PSA screening tests, When caught early, prostate cancer is more than 95% curable. Cancer screenings can save lives. They can truly be the difference between life or death. However, they are only effective if the people who need them can get them. For many, the cost of cancer screening prevents them from detecting cancer at its earliest, most treatable stages. Senator Booker introduced the PSA Screening for Him Act because all individuals at high risk for prostate cancer who decide to move forward with screening after a discussion with their healthcare provider should be able to do so without any cost. Thank you again for your dedication to this issue and for volunteering your time to advocate for lowering the burden of cancer for everyone. Senator Booker looks forward to receiving your postcards, especially those coming from the great state of New Jersey. On behalf of Senator Booker, thank you for your time this evening, and thank you for letting me join you all.
Myself. Thank you so much, Nadia, for those wonderful remarks. And, we all appreciate not just the great work that Senator Booker is doing, but the great work that you're doing. You have 1,000 things on your plate, and for you to take the time to come talk to us this evening is an honor and a privilege. And as a 20-year Hill staffer, and my boss, Tammy Boyd, is on here too. We both want to say thank you again. And we look forward to getting this bill signed into law. That's where we're going to end. So, right now I turn it back over to the handsome David Ford. Dave.
Thank you so much, James. And Nadia, I echo the same comments as James to Senator Booker and his efforts to support this bill. Tonight's ACS federal team will talk to us more about a bill that will save lives from prostate cancer. We will listen to the story of a prostate cancer survivor. We will work together to write our postcards to our senators. As the official advocacy affiliate of the American Cancer Society, ACS CAN empowers volunteers across the country to make their voices heard, to influence evidence-based policies that reduce cancer burden for everyone. We believe everyone should have a fair and just opportunity to prevent, detect, treat, and survive cancer. James and I both are two-time cancer survivors. We want everyone to have that same opportunity as us. Visit fightcancer.org. Find out more about how you can become a member of ACS CAN. As part of ACS CAN's deep commitment to reducing cancer disparities and building a more diverse and inclusive organization, the Black Volunteer Caucus, known as the BVC, was established in 2021. The BBC is advancing awareness, education, and involvement of the Black community and a voice in ACS CAN's initiatives campaigns across this country. Tonight's event is in partnership with BVC. Learn more about BVC and join BVC at fightcancer.org/BVC. It gives me a pleasure to bring back James again. He's the Federal Director of Relations for ACS CAN and a longtime volunteer. So let me bring him back up to the stage, and you'll learn a little bit more about James's skill later on this program and what he's able to deliver for us.
Well, thank you, David. Thank you so much for that kind greeting again. And, tonight I just want to talk to you about the PSA Screening for Him or High Risk Insured Men Act. As Nadia mentioned earlier, this bill will require health insurance providers to cover prostate-specific antigen or PSA blood tests for people at high risk for the disease at no cost. That's what ultimately saved my life. Look, I'm 63 and I was 39. I know I don't look like I'm 63, but I was 39 when I first was diagnosed with prostate cancer, and it came back when I was 44. So the PSA test saved my life. Those at highest risk for prostate cancer are Black individuals and those who have a parent or sibling who has been diagnosed with prostate cancer. And screening can help find prostate cancer at an early age, often before any signs or symptoms are present. I didn't have any signs or symptoms, and I'm sure David probably didn't. And we're two survivors because we got that prostate cancer screened and treated earlier. And that is key, because when you get it before it becomes an advanced age, then the odds, as Nadia mentioned earlier, are over 95% that you'll be cured and you'll have a long and thriving life. However, out-of-pocket costs can be a barrier to accessing screening. I was fortunate that my health insurance didn't have any co-pays for that, but lots of people don't. ACS CAN supports this bill because everyone who's at high risk for prostate cancer who decides to move forward with screening should have access to screening that is barrier-free without any out-of-pocket costs. That's something that is so vital. And David, you know that yourself. We've both been beneficiaries of that.
Yeah. James, I appreciate your comments and the importance of the sincerity of us making a difference and an impact. And that's why we're here. I want to thank you for explaining the importance of this piece of legislation. It is essential that we continue to work toward passing this bill to remove barriers for accessing screening. And up next, we're going to hear from Herschel Chalk, a two-time cancer survivor and a longtime ACS volunteer from Ohio.
Herschel Chalk. I live in Cincinnati, Ohio. I am a 27-year, two-time prostate cancer survivor. I was blessed. I was on a job and I got insurance. And since I got insurance, I figured I needed to get a physical. So I went to the doctor and I got a physical. And the doctor told me that everything came out okay. It was good, except he didn't like my blood work and he wanted me to see a urologist. So he recommended a urologist to me, and I went to see her. She did a biopsy and told me I had prostate cancer. It was really not devastating to me. It was just another hurdle that I had to go through in my life. And so she asked me what would I like to do and told me the different options. And so I told her, I said, well, I'm young enough that you can take it out. I'm not having any children or anything, so you can take it out. And so we went on and took it out. She told me I tried to save some nerves and so forth, but I don't know if I did or not. Then after a while, I started having incontinence and I had ED. But that did not really bother me because I was still alive. And to me, that was most important, to be able to be alive and continue to live my life and enjoy my life. When I healed and I thought about trying to help men, the thing that got me the most was the fact that I was a survivor for a reason. And so I would tell people a lot of times that the Lord needed a mouthpiece and he knew I would not keep my mouth shut. And so therefore, I'm a survivor to go around and talk to men to try to help them. So I think it's very important that we write to our senators, tell them how important it is to us that we get this bill passed so that men can have free screenings and be able to move on and continue living a wonderful life. My name is Herschel Chalk.
Thank you for that compelling story, Herschel. We want to continue to pray for you and bless your family during this holiday season. But more importantly, thank you for sharing your story. It's clear from Herschel's story that early detection is key and further makes the importance to push for this bill to be passed. So we're going to shift gears a little bit. We're going to now talk about PSA screening for the HIM Act and hear from prostate cancer survivors. Let's talk about our postcards. So get your postcards ready and your pen. Our goal is for the Senator's office in Washington, D.C. to be overwhelmed by a number of postcards urging them to support this bill. We are each writing 2 postcards tonight, 1 postcard for each U.S. senator. If you aren't sure who your senators are, please use the link in the chat and find out who they are. If you're having any problems with that, just indicate that in the chat. Additionally, on the screen, you will see the address where we would like you to send the postcards. We are sending the postcards to James at the ACS CAN office. This way, James will be able to personally deliver the postcards to your senators. Furthermore, please be sure to include your home address on the upper left-hand side of the postcard. This is necessary for the offices to be able to confirm that you are a constituent in their district. Earlier, you heard my phone ring, and that was the postmaster calling me to make sure that James was going to deliver those postcards on time. So as you write your message, I recommend keeping it simple. On my postcard I am writing, please co-sponsor this bill so more men can survive prostate cancer just like I did. You can see a few slides on what to write on your postcard on the screen right now. Additionally, I see some great examples in the chat coming from some of our BVC members. After you have completed your postcards, take a selfie with your postcard or a picture of the postcard. Share the postcards on social media. Tag your senators. Tag ACS CAN at ACS CAN and use the hashtag PSA for him. Sharing these actions on social media will help you spread awareness about prostate cancer and help us hold our lawmakers more accountable. After you shared on social media, make sure you put a stamp on each one of these postcards. I'll say that again. Make sure you put a stamp on each one of those postcards and drop them in the mail by December 13th. So our designated mailman, James, can pick them up and deliver them to the senator's office. Now I want to take a few minutes to answer any questions that anyone may have on how to complete their postcards. My colleague, Leslie Ferreira, is going to read us a few questions now.
Thanks, Dave. I don't know what I did in my life to get so lucky to be on the stage with both of these fine, distinguished men, but I'm just relishing in it right now. So yes, I'm looking at the comments, I'm looking at the questions, and we got this one a few times, Dave, if you wouldn't mind answering it. Why are we sending the postcards to James at the ACS CAN office and not to our senators directly? Why are we doing that?
Because James has been designated as our chartered mailman. That's a great question. And when we send mail to the lawmakers' offices, it can be delayed with security at the Capitol. So by sending the postcards to James at ACS CAN office, we can ensure that our lawmakers get the postcards on that certain timeline.
Yes. And I just want to add that the importance of these postcards are, look, I worked on the Hill for 20 years and most members get email when they rarely get postcards these days. So when the member of the House or the Senate sees a postcard, they know that you've taken the time to go out to get the postcard. You go ahead and write and fill your address on the back of it, and it was delivered. And let me emphasize what Dave said. Please get your stamps. And mine, I'm sending my 2 postcards out with my John Lewis stamp. So be sure to get your stamps and put them on those postcards today.
Thank you. Thank you so much, James. And I'm sure those offices love to see you too. So that's just an added bonus when they get delivered by you.
You're too kind.
Okay, we got another question, Dave. This is a good one. My friend wanted to participate in the event tonight, but she couldn't join the call. Is there still a way for her to participate and get involved?
Yes, of course. If anyone isn't able to join tonight, they are still welcome to participate. They can watch the recording of the call and fill out their postcards. Or you can visit the website in the chat, or you can also find the information to send the postcards on your own.
Perfect. So people can still get involved even if they didn't participate tonight. Just send those postcards in, and all the instructions will be provided on our website. Awesome.
Yeah,
okay.
we want to see so many postcards coming in that James has to have 2 or 3 people carrying them into the Senate office. I mean, he's going to take off that bow tie and that blue jacket, and he's going to, yeah, that's what I'm talking about.
That's right.
I love it. I love it. We're going to get some pictures of that for sure. All right. Be following us on social media if you want to see James delivering those postcards. Okay, we have another question for you, Dave. I printed out the digital postcard provided by ACS CAN. So they printed the postcard out. And should I fold it before sending it, or what do you suggest?
Okay, if you use a printable ACS CAN postcard, please fold it in half and add tape to the inside of the fold. This should secure the postcard without adding additional weight to it. After that, you put the stamp on and place it in the mail. Again, put the stamp on and place it in the mail.
Excellent. Okay. I have another question for you. If I live in Washington, D.C., so this is one of our friends in Washington, D.C., so I don't have any senators. Who do I send my postcards to?
Well, for anyone living in Washington, D.C., Puerto Rico, Guam, America, Somalia, the U.S. Virgin Islands, or the Marina Islands, we would ask you to please write your postcards, send your postcards to your representative or delegate in Congress. Please use the same link that was provided to search for the senators, search for the representative or delegate.
Excellent. That way everyone can participate. So we want to make sure that you can participate no matter where you live. Get those postcards in. Okay, another question came in. Will the recording of this event be available if people want to listen to it again or share it with people?
Well, yes, it absolutely will be available on fightcancer.org website, where all of the material for the events are. Please feel free to view the recording here or to share the link with anyone who couldn't attend the event tonight. I'm going to watch it probably 2 or 3 times since I was honored to be on this stage with James.
Absolutely. I am too.
Thank
I'm going to
you.
keep it on repeat. I'm going to keep this on repeat. I do have another question that's coming in, James, and this one's actually for you. Would you be able to share, we posted it, but could you say it as well, just in case people can't see it in the chat, the bill number?
Yeah.
What's the Senate bill number?
Okay, good question. The Senate bill number is S2821, the PSA Screening for Him Act. And the bill was originally introduced by Senator Cory Booker and John Bozeman from Arkansas, Republican from Arkansas. And there are 2 co-sponsors, Shelley Moore Capito from West Virginia, Republican, and Maria Cantwell, Democrat from the state of Washington.
Excellent. That's super helpful information. We really appreciate that. Well, it looks like that, I think we did it. I think we answered everyone's questions. But if anyone has any additional questions, pop them in the chat and we will do our best to answer them in the rest of the time we have together. Thanks for letting me share the stage with you, gentlemen. It's been a pleasure.
Oh, you're welcome. Thank you.
Thank you so much. It's a pleasure working with you, and as well as participating in this worthwhile cause tonight. James, as we end this year of a long fight and work that we've done to help people survive cancer, to access to our programs and services. I'd like to give a big thank you for getting Nadia from Senator Booker's office for joining us tonight. I hope she helped inspire you all to keeping the work up on this issue. I'd also like to thank you again, James, and Herschel, and ACS CAN Black Volunteer Caucus for their many contributions tonight. Additionally, I'd like to thank the leaders in the prostate cancer field, Zero Prostate Cancer and Prostate Cancer Health Education Network. I have a few friendly reminders for you all. Please share your pictures of your postcard on social media using the hashtag PSA for him and tag ACS CAN. After you have shared, please get your postcards in the mail by December the 13th. That way, James has to make 2 or 3 trips carrying those bags of postcards into the Senate and congressional offices. I just can't wait to see that. I hope someone takes a camera shot of him carrying all those bags. Please be sure to follow ACS CAN on social media to stay up to date on PSA screening for the HIM campaign. And with that, I'd like to thank everyone who made time to be with us today. We appreciate you and your hard work toward advancing health equity and eliminating health disparities. I want you to have a wonderful rest of your week and really a blessed and safe holiday season with you and your family and your loved ones. Thank you so much for joining us.
Thank you. Thank you so much. Happy holidays. And, again, do this because you want to help someone you love. And we're all about part of it. We're all volunteers. We're all hardworking. Thank you, David, so much. Thank you, team, for putting us on this most important event on this evening. Thank you, Black Volunteer Caucus and everyone. And like Dave said, have a great, safe, and happy holiday season.
Send me one of those